Hi, good morning and good evening. Let me welcome you to the Ask Us Anything session on BG CoviFund. I'm Abhishek Sinha. I graduated from BIT in '99, and now I am one of the two BIT alumni co-founders at Echo.in. I'm based in Gurugram, and I'm a volunteer for Bitosa, Delhi NCR, and also currently volunteering for BG COVID War Room. Let me again take this opportunity to talk about the BG COVID War Room initiative for those who may not be aware. This initiative took off towards the end of April, beginning May. This was the time when we were experiencing the peak of COVID raging across the country, and many of us were witnessing flooding of messages in our various city groups where people were reaching out to seek help, to get access to oxygen, ICU beds, ventilator, and so on. Also, many of us were involved in those groups trying to help fellow alumni. Some of the volunteers at Bitosa Global got together and to centralize this effort such that we can cater to alumni from across the country and also those outside India who wanted to help to reach their families in India. This led to the formation of BG COVID War Room and the BG SOS Task Force. Most of you here who are regular at our events and must have met some of the volunteers of the SOS Task Force and heard their experiences. If you have missed, please watch the awe-inspiring talks by the Task Force volunteers on our Bitosa Global's channel on YouTube. One thing led to another, and we now have 6 initiatives under COVID War Room, starting with COVID OxyLife, COVID Suraksha, CoviClave, SOS Task Force, and today we will hear from the CoviCare Expense Committee and the CoviFund team. Please check the COVID tab on the bitosaglobal.org to read more about these initiatives. We are making great efforts to keep the information updated on the website. Let me now welcome the speakers for the evening, my seniors and the lead volunteers. I'll start with Mr. Nikhilesh Krishnamurthy. Nick sir graduated from BIT Mesra in 1980 in mechanical engineering and got his MS in industrial engineering from the University of Illinois at Chicago a few years later. He has been working in the software application space and is currently with Visa in the information products group. He's a publisher, author of a book on software development and is an active member of Bitosa Silicon Valley, where he now lives. Nick sir is currently the lead volunteer with the Expense Committee. Our second speaker is Mr. Ashok Krishnamurthy. Ashok sir completed his mechanical engineering in 1981. A short stint at Telco Jamshedpur was followed by an MBA at IIM Ahmedabad, after which he worked in IT consulting companies for close to 30 years in various business roles. He moved to US Silicon Valley in 1999, and as part of a startup called Aztecsoft, he was part of the leadership team that took the company public. Aztecsoft later got acquired by Mindtree in 2008. He was then the president of Mindtree's high-tech business for several years. Having been there and done that, over the past 2-3 years, he has now been advisor and consultant to technology startups in Silicon Valley. And now yet again, he says that he's at the exciting phase of figuring out what different, what next. Ashok sir is currently volunteering with the BG COVID Fund, the fundraising committee. And finally, we have Gautam Haldar sir. Gautam sir completed mechanical engineering from BIT Mesra in 1989 and started working for Tata Group in Jamshedpur. He later did business management from XLRI in 97. And after working for 12 years in the Tata Group, he joined Timken, a US multinational, and started working for their global R&D from Bangalore. After 17 years with Timken, he founded a consulting company based in Pune, a passionate technologist in the areas of core engineering. He's working with major heavy industries of India, as well as some customers overseas. He has presented several technical papers in various national and international conferences. and connected to various engineering groups in India as an active member. Gautam sir is the lead volunteer at the PG CoviCare, which is our family support group. So with that, let me actually start with the very first question to Gautam sir. So why did the family support team come into existence, and when did it come into existence?
Yeah, very good evening, good morning to you all. We are from people from different time zones. Avishek, first of all, I sincerely thank you for the kind introduction for all of us. To answer your first question, why did family support team come into existence? Yes, as you all know that like in many Indian families, our BITN communities also severely got affected. Many of the BIT students lost their bread earner and other family members. Many professors and staff members lost their life. So through different interaction, we felt that this is the time we need to come together and created various group task force to address this challenging time and reach out to various families to support them mentally, financially, or whatever emotionally, whatever way we can do in this difficult time. So we created this COVID support family group with the help of volunteers who are very dedicated. In many cases, we work to help the various VITians through counseling and, of course, mentoring for giving them support through internship and job opportunities. And wherever it is needed, we try to understand their pain areas, problems areas, and did our little effort to give them some kind of comfort. So that is how the family support team came into existence.
And just to ask you further, Gautam sir, uh, what numbers are we talking about? How many families of alumni, of students, staff, faculty, how many of them have got impacted? You know, are these numbers a few or are these numbers large?
I will say it's a quite a significant numbers, almost 55 plus, to be very precise, 57 cases as of now, from students, faculties, alumni, and also from many various staff members. We can recall that around more than 10 cases are from, 15 cases are from faculties and the professors of the VIT MESRA, and many students and alumni, of course. So 55, 57 is a big number, as you can understand, and still some cases are coming. So we expect maybe some more cases will come. We don't want that. We want less number of cases because this is very difficult time for the families. But if there are some cases, we'll be very eager to help them and address the issues.
Ashok sir, if I may come to you, uh, why did at Bitosa Global COVID War Room, why did we at all start a fundraiser? Was it what Gautam sir is saying? Was that the trigger? Or how did we uh, get about triggering this thought that we should go ahead and raise funds?
Yeah, I would say it was a very organic process. And as you had explained at the beginning, there was this crying need for people to come together and help a community in pain. I mean, the entire country was in pain. And the BIT community of students, alumni, staff, they were going through a lot. And I think it was the bunch of volunteers who got together, probably without any funding support, but just with the intention of doing good and saving lives. And as they got together and this whole initiative picked momentum, obviously there was a need to have funding come in so that the whole program could scale beyond the city where it started and spread across to the rest of the country. So while the COVID relief and support program actually started without any clear intention of how it would get funded, it was just a reaction to the crisis. On May 14th, the group put together a fundraising program. And that's when formally the fundraising program got kicked off. Otherwise, the people were just dipping into their own pockets and making things happen. But as with any program, once it has to scale and deliver outcomes on a meaningful basis, it requires funding support. That was the genesis of how the funding program started.
And so do we have a end date to this fundraiser?
So when we began on May 14th, we set June 30th as the end date. And we also set for ourselves a audacious goal, if you may, of collecting 2 crores of rupees. But as we moved along, we realized that there is a lot of need. I wouldn't call it demand because that's inappropriate to use under these circumstances, but the need keeps increasing. And as Gautam said, more and more families are reaching out. Hopefully there is no third wave. So, still to cater to the requirements of the second wave, we do intend to extend the timeline beyond June 30th, probably for another 2 months at least. But as we speak, the timeline is scheduled to end on June 30th. So it was from May 14th to June 30th as per the original plan.
Got it. Nick, sir, if I may come to you, I really am intrigued by the finance expense team, and I want to understand that why do we need a finance expense team? Isn't it straightforward that somebody needs help, we get the money from the campaign, we simply pass it on to them? Sorry to be asking this question.
No,
why do we need this team at all?
That's a good question. Okay. And especially when things are moving very fast and there is organic growth, it appears you just put everything in a fund and just keep drawing from it. But you see, this is Bitosa Global is a formal organization, and we do expect questions will be asked, audits will be done later, and we are not talking of very small amounts of money. As the funding committee has raised, we are already at 55 lakhs, and then it may be going up. So these are substantial amounts of money, and we want to have some way whereby at the time of, we can decide how money is disbursed to meet the goals of all the programs that we support. See, we don't decide the programs, but we support the programs. At the same time, the committee will make sure that some documents are kept in place so that the organization itself is protected in a way. Okay, so that's why a little formality is introduced, and I think that's a good thing, and it helps in things to scale. Otherwise, it becomes first come, first served in the way expenses are managed, and that's not always the best way.
Got it. So assuming that I am a donor to this campaign, how is Bitosa Global satisfying my information needs? That yes, my money which I have contributed with a certain thought that okay, it will be used for a purpose to maybe help a family. How do I get to know how effective this has been, where my money has gone, has it been put to use or not?
Correct. So 2 things. One is all expenditure is program based. Those are the programs that you mentioned, okay, related to family support, oxygen concentrators, okay, other SOS activities. So there are specific programs, again, for which the expense committee has allocated certain budgets, Abhishek, okay? And any request that comes from the program, is reviewed and is basically tracked against that budget. Now, at the beginning itself, we decided that because conditions changed so fast on the ground, remember this thing is all happening in June, when we began, the concentration was on oxygen concentrators. So we had allocated more money for that, thinking we'll need a lot more and supply would be a problem. But then suddenly things have changed, and now the focus is on the family support group. So currently we have about 20% for the oxygen care, and we are drawing the line there. And for family support, we have 60% of the funds are allocated. Okay, and all the requests are formally tracked through formal request forms. Okay, and we basically keep very detailed spreadsheets of where the money is going after it is approved. So if any donor wants to know, it's really in some sense, the money will go to one of these programs. okay? And what is happening within the programs, the program leads and the expense committee can tell them. But it's not a direct, one-to-one instance. I gave X dollars, where did that go? Okay, it goes into a general pool and then is spent for programs.
And so Ashok sir, there's a question from Prince where he's also asking that, how do we ensure that all requests are attended to? So my intent of my question is that Nick sir talked about various buckets in which money is getting allocated. Is your fund campaign also talking about these various buckets? I don't know how to interpret Prince's question, but he's also saying that anybody who requests help. So are we also looking at helping people beyond the BIT community? What is the messaging that we are going out to our donors, and who are our donors? Are they also from BIT or beyond BIT as well?
Okay, good question, Abhishek. So let's call this phase 1 of the program, that we started on April 30th and where we are today. So in order to have the maximum impact of our efforts of fundraise as well as delivering outcomes on the ground, we as a group decided, the entire leadership, that we'll keep our focus entirely on the BIT community. Now, this community includes students currently at BIT, alumni, as well as BIT staff who are working there, and their families. Now, we know that there were many thousands of people in the country who were severely impacted. But in phase 1, we decided to keep the fundraise drive confined to the BIT ecosystem across the globe, as well as deliver outcomes for the BIT community across India. So that was the goal of phase 1. Now, the leadership team is in discussions internally to determine whether we should reach out beyond the BIT community for fundraise. Now, even if we do that, should our messaging continue to remain focused on delivering to the BIT ecosystem or go beyond? Any individual or family that is impacted, whether they belong to BIT or outside, needs help. But it's a question of how optimum our collection efforts can be and how optimized our delivery outcomes can be, which is why we are currently keeping the focus on the BIT community, which I described comprises a few different subgroups, but that's been the current focus.
And that leads me to the next question, Gautam sir. So, you spoke about how various families are impacted. Can we get to know a little bit that what are these families really facing? Why do they need financial help in the first place? For how long do they need? And Ashok sir mentioned that we have raised over 55 lakhs. How are you looking at? Is this enough for you? Do we need to raise more?
Okay, good point, Abhishek. Let me go a little back. Our first approach is we identify the cases through case master sheet. And we identify a first information volunteer. We call it as a first information volunteer, who is the first guy contacts the family. And the first and foremost, if there is any major case like death cases, the breadwinner lost the life and student or any faculty member, we try to understand, we first listen to them, try to understand and gauge about the mental condition and the real situation, what's happening in their family. And if probably someone is under a depression, some cases there is a mental issues, or some cases there are severe medical treatment support requirement. So we try to understand all this, and some cases where the breadwinner is lost their life, having living small kids and housewife, there is no one to earn in their family. In that case, of course, we go with the financial support. So these are some of the challenges the families face. And in the first interaction, we try to understand the actual situation the family is facing. And based on that, we also subsequently plan for more number of interactions, because in one interaction it is difficult to get the family understanding and their trust also, because many cases the family don't want to spell out what are the problems they are going to face. Many cases they said possibly at this moment they are not very clear. I personally interviewed some question, I mean discussed with some of the families, some other volunteer, Vishnu, Vishal, another Sunny, so they can share that it is first that you have to give a very patient hearing to the family, understand their problem. Something could be physical, mental, hospital support, financial challenges. Some cases, maybe it could be a career support, internship support for the young VITians. So that is how we try to understand the problems, and accordingly we take our further action and plan for subsequent calls. In each case, it takes around 3 to 4 round of discussions in a gap of 4 to 5 days sometimes, and so as to give us our final assessment, and then we discuss, debate among other volunteers for each case, and accordingly place for the request to finance team or any other career support team. And that is how the things work out. Hope I was able to give you
So,
the input what you are looking for.
absolutely, sir. And you initially mentioned about 54 such cases where intervention is needed.
Yeah.
Is there an estimate? Do we have an estimate that how much money do they need? And listening to you right now, one also believes that some of this money will be needed even for the long term. So they are not just short-term needs. What kind of long term are we looking at? What does long term mean? 2 years, 3 years, 10 years? And how much money cumulatively are we trying to look at?
See, as of now, we are focusing on for next few months time. But as you have said that, yes, there will be some requirement for next 2 3 years, depending on the students, which year, current student, in which year they are in. Our, as of now, estimate is around close to 40 lakhs we expect by July, August time frame we have to disburse. Of course, we will discuss with the finance team for the further disbursement. Like 10 lakhs, as 10 plus lakhs have already been disbursed. So we expect 40 lakhs by July, August. But as you have understood very clearly, there will be many cases where we have to support. Some cases the students are directed towards the sponsorship program, which is another initiative, and yeah, and through different other financial support. So as of now, the figure is 40 lakhs out of the total cases we have handled, and the total cases we have handled is around 55 lakh. Yes, the figure which you mentioned. So that is the current scenario as of now. And I
So this
personally
is
feel, I just had to add 1 or 2 lines more. I personally feel this family support group should be an integral part of our overall BG initiative, because I can understand and I can see feel the pulse that this group can make a difference, and first and foremost, the lives of the BITians and the future BITians. So maybe this could be a trigger point. This COVID is one of the trigger point from which we have started, and this can go in a long term, maybe 2 years, 3 years, 5 years. And as the BG exists, possibly this could be a regular part and regular feature of the BG support to our alumni as well as our faculties and the professors, I mean staff members.
so, sir, are we saying that we are well within budget, that we need about 40 lakhs and we have 55 lakhs, or do we need more money?
No, yeah, that's a good point, and thanks for reminding that. See, as of now, 40 lakhs is the projection, but even today morning we got some case. So maybe some more cases will come, and some cases we see the requirement, the requests are very high. To give you the figure, it is almost 90 plus lakhs of requests has already come from the family members. So the
Oh,
requirement
okay.
is much higher. So yeah, I just missed out that point. Almost 93 lakhs plus request has already come from the family group, and that then we are assessing each and every case in consultation and advice of the financial and other mentors. So 93 lakhs has already been put, request has been put, and there are 1 or 2 more cases where the requirement could come much higher to that. So definitely we need much more fund than what is current projection based on the initial discussion we had with the family.
So I've actually got a question for both Nick sir and Ashok sir with what Gautam sir just mentioned. And also Anupam has a question that what is our model for sustainable support and how are we going to do this? Continuous donation collection is a big challenge. So Nick sir, first, very clearly, I understand the importance of the expense team because we have a requirement. We already have a requirement of 90 plus lakhs, and we have just about 55 lakhs. So very clearly, so this is a difficult task. How are we? This is like being very judgmental on case-to-case basis.
Yes.
And so how are we saying that, because we can't fulfill 93 lakhs?
No, I agree.
And so my
Thanks,
question is
Abhishek.
that, yeah, how are we going to do this? Because to some we may be able to satisfy, but to some we may not be able to.
In fact, I would say, we are trying to support, but you raise a very important point. It's not just the 93 versus 55. Even in 55, please note only 60% of the budget is allocated for family. If the other funds like oxygen and all don't draw any more money, okay, then we can move some increase here. So it's not even the full 55. So the gap is quite substantial and fundraising is needed. At the same time, Abhishek, you raise very important points, and we deal regularly with the family support team, which is doing excellent work, because there's an emotional aspect to every request. This is not just, just asking for money kind of thing, and it's not a claim or anything. So there are a lot of emotional factors. So one of the things that initially we were also impacted, after all, we are human, by the conditions of the family and trying to decide. But now in the month of June, we have put in place a few processes. There is some basic form that the family support group has to fill in. We need to understand, who is the person impacted? Is it a relative of the BITN? Is it the BITN himself or herself? Okay, what are the other circumstances of the family? What is the amount requested? And based on that, we have set certain caps as a process. Though I'm finding that in every meeting we tend to sort of go over the cap, but we begin with a cap at least. If it's some straightforward medical expense, our cap was initially 50,000. If it was for a faculty member or a staff, or where the BITN has been deceased, then it was 2 lakhs. And if it's a relative of the BITN, like a father, a parent, or somebody who's burning, it's 1 lakh. So we had kept to 51 and 2 as the cap amounts. And then we look at all the conditions of the particular family. And do they have any other sources of help? Do they have medical insurance? Are they working for an organization which will reimburse? So we do take some factors into account, Abhishek. Okay, for the simple reason that we don't have enough money to really just give whatever is requested. It's difficult for everybody to say no, but we have to, as you see in June itself, we have approved about 11 lakhs. At this run rate, and with a total budget of 33 lakhs, we really have money for July and August. So what's the point in running out of money? It's very difficult to run a program if you run out of money. So we have some things and we say no sometimes, yeah.
And so very clearly, we have just about maybe 35 lakh rupees for the CoviCare or the family support group. And we need 95. Ashok sir, how do we bridge the gap?
Yeah, that's always the management challenge, right? And that's why we have a wonderful team working together to get to our goals. So, just to go back to some numbers, since the time we started the fundraise campaign on May 14th, and as we speak today on June 26th, 40 plus days, we have raised around 56 lakhs or $80,000 from donors across the globe. We are immensely grateful to all donors who stepped in with amounts big and small. Every rupee dollar collected reflects the donor's compassion and service. However, as we just heard from both Gautam and Nick, a lot more needs to be done because families continue to reach out to us for their children's education and medical bills. And there are BIT students who've lost their only bread earning member, and therefore their families need support, sometimes financial, sometimes emotional. The entire efforts of all the donations collected are going towards helping the impacted community. So we have so far collected at a reasonably good clip of $2,000 per day, but the momentum has to pick up. And therefore, there are different approaches being undertaken, besides email outreach. There is one-to-one calling by various volunteers. Social media outreach has also been pretty active. But let me just make one comment on where we have seen the best success, and that's when batches have had champions within their batch trying to evangelize and take the word around in their batch. So, there are different ways in which we could go about raising more money, and those are initiatives I can talk about later. But the immediate target audience should obviously be our batchmates. And the history over the past 2 months shows that if we have a champion or a couple of champions in each batch that take the messaging forward and provide full information and transparency, your batchmates step up. And if on an average, from every batch, we have about 50 contributors, which is not a very big number. In some batches we have reached 50, and in some where there hasn't been a champion, the numbers tend to be at the low single digit too. So I would urge all of you who are listening to this, as well as spread the word around, that within your batch, increase the outreach, make a personal appeal, and we can definitely get to the goals that we have in front of us. And I'll just pause here. There are other initiatives also we can talk about as we go along. But that
so
would
there
be
is a suggestion that if the donations to BG can be made exempt from income tax under Section 80G, so very clearly we don't have that right now. But are there plans for getting such approval, sir?
So, at this, I would defer the question on how Bitosa Global NCR is managing that process. I think there is a certain status that is required for entities to allow donors to have tax exempt contribution. But as was mentioned in the campaign itself, currently the donations are not tax exempt. I stand to be corrected if I'm wrong about that. But as far as BIT Global NCR or Indian Rupee collections are concerned, we just stepped up to meet the need of the hour. Maybe some steps need to be taken to make them tax exempt. But I would ask either you or Neeraj or anyone to comment if that is a process underway. I can further comment on what the status is with regard to Bitosa Silicon Valley, but let me just pause here to allow someone from Bitosa Global India to answer the tax exempt question, if they can.
Actually, so there is a, and so are there any plans, because there was one question around sustained help. So instead of, as a donor, do I have an option of giving something every month, or is it only one time option for me?
Yeah, so currently we are set up to receive contributions on a more than one time basis. You can kind of obviously donate multiple times, but we haven't set it up yet to receive contributions on a periodic or monthly basis. That is something which we would definitely like to work on.
Or there is actually a comment from both Neeraj sir and Ayush sir that we are working on the ATG exemption. So that was a comment by Mr. A. Bharadwaj. I have a question from Saloni Shwetambara. And she is asking that there are government initiatives, central and state level, for providing financial support for the affected families. Are we leveraging those effectively? Gautam sir, would you like to take this one?
Yeah, that's a good point, Saloni. In some one or two cases, we remember we discussed among our volunteers about this government support, state government and the central government support. We are exploring the options if if the financial requirement is much higher, without naming the family, I can tell you. Then we are also trying to see if something could be managed through the state fund or the central government fund, and thereby that large requirement can be partly met through them, and some part we can take care, and some part through other financial program that family is already taking support. Yes, we definitely discuss in one or two cases about that program, and but that takes time. To be very honest, any central government or state government, it takes time. But for immediate support, definitely we are extending our support from the family team.
Gautam sir, there is one more question. I think it would be best for you only. How exactly do we assess if someone really needs this fund, or maybe they can utilize their own assets? Are we factoring that?
Yeah. Whenever, as I said earlier, that our first information volunteer, when they talk to the family, they first listen to them, and from that discussion or understanding, he or she prepare the list of points, list of information we gather from the family. Then we discuss among our volunteer group, and we prepare our own list of things, like what are the coverage the family has. If let's say the family has a requirement of, let's say, 10 lakhs, so what are the different other options, the insurance coverage, the medical insurance coverage, if there is any ongoing COVID treatment, if there is any death case, the life insurance, or if there are any asset part involved into the PF or any other gratuity or any other support the family might have. Based on that, after having the first round of discussion, we also try to assess through a second volunteer. Like in case the first volunteer, whatever information he or she has collected, we try to validate that, and thereby we are sure after 2-3 rounds of discussion through two different volunteers, we more or less get to a point and to understand the exact scenario of the family, where how much we can need. Yes, for 93 lakhs was the total request by the family, but possibly we can meet up to 50-60 or maybe more or less. So based on separate criteria, different criteria and different points, families condition, we arrive at a certain recommendation point to the finance group, and that is how we assess. So we take care all the finance sources of finance for the family, suffered family, and based on that we take a call. Yes, there could be some judgmental error, that is very much possible, because no one can get the full information from the family without understanding them for a long time, but we have to take our own call, and we take the judgment based on whatever information we collect.
Next, there's a question from Prince. What are the challenges we face in this group? I can see that we have so many programs running in parallel, and our fund is very, very limited. I know of oxygen concentrators, teleconsultation, CSR. How do we ensure to onboard the people who are not involved in this?
Okay, the last part of the question. Okay, let me address the thing. There are a lot of programs, and for anything to work, there has to be very razor sharp focus. Okay. So I don't want to comment on, but if we do have a lot of programs, the biggest danger is that we spend ourselves too thin, so there won't be, sufficient impact. So that is something, because this is very new and we are still learning a lot of things and we don't have too many data points. Okay, so this is something that will need to be tuned. But I agree that even in family support or the requests that come to us, maybe we need to narrow it once we see the cases, Gautam and others. Okay, that maybe what we can do very well is that any family member who has a college fees issue, we can address that practically fully. Okay, but we cannot address, say, medical bills issue, or we can address medical bills, but not ongoing college. Okay, a little more narrowing of our scope will help us be more effective is what I think, but it's a little early for us to say that. And the second half of the question, Prince, what was it? You were saying, how do we get more people to join what, the program or the expense committee? Prince?
Prince, can you unmute yourself?
Do we have to unmute?
Meanwhile, Neha, your hand is raised. Do you have a question? Why don't you go ahead and ask?
It's actually very near to what Prince is asking. And since we have seen the number of volunteers who have been part of the SOS initiative from day one, I wanted to ask all our speakers today, and maybe anybody else, that if I am a
Your audio is breaking
Your
up.
audio
Your voice is breaking.
Okay, is it better now?
Yes.
Oh, yeah.
Yeah. So if I have donated or if I have been part of BG, can I also become part of the focus groups? So this is one of the questions which we get most of the time. I would love to hear from all the speakers. And the other very interesting thing is, like, I know you all have a very busy schedule, Nick sir, Ashok sir, and Gautam sir. What motivates you every day in the morning to come and join for the BG calls and see the volunteers, talk to the volunteers, and give us, motivate other volunteers? What is your one passion that inspires you to be around the Vitosa Global team?
Let me say, because about nearly 30 years after I left BIT, there was no connection with BIT. Okay. I was not involved in any way or something. And then once I got an email invitation in Silicon Valley that, the Vitosa, I don't even know if it was called Silicon Valley, okay, is going to meet, and it was on my way back from work. So I just drove there and I sat in, and I, was meeting folks who had just graduated and things like that. And there was a lot of energy there. So after that, I continued to associate with Vitosa Silicon Valley, where Ashok is also there. And, and most of it is the networking events, recreational events, hiking, table tennis clubs, and those kind of things. Okay. And so that's how it's been going on. Now, this crisis that has happened, I can see especially when I started seeing all the WhatsApp messages, Neha, on the SOS group, which gets posted, and there's nothing more transparent than that. Okay, then one really realizes that one should help what one can. Yeah.
So speaking for myself, I think Neha, what motivated me are a bunch of reasons. Of course, the bonding to our institute and the crisis that came upon our entire community. But most importantly, I drew inspiration from all of you who had actually selflessly stepped up. And at the risk of missing names, I will take a few. That's you yourself, Neha, Vishnu, Chandra, Prince, Vishal, and there are so many others. You set the example that you didn't need a big organization to get good work started. So when there was such fantastic work being delivered on the ground, I felt I should just not be asking too many questions, but step in to be part of this momentum. So, that's what motivates me.
To answer my part, Neha, I think some part has already been answered by Ashok sir. I always get an inspiration seeing you guys like Neha, Vishnu, CS, Prince, some of the names, I mean, Piyush. Definitely, you people are bring in a different kind of energy. And as you know, Neha, I'm connected to many other social groups. So it always gives me a different kind of energy and passion to be more connected with the groups. And that too, if that is from the BIT family or alma mater, then definitely it's a different kind of experience altogether. So every morning I hardly remember in last 1 year, how many times I set up a call at 9 o'clock with my customers or my business partner or my own team. But every morning I wake up at 7 o'clock, prepare for the day, and then very religiously start the meeting at 9 o'clock family club. It is something, a different kind of experience, very passionate and different kind of, because it gives an opportunity to connect with the people, with the families where people are affected, and of course our very energetic and dedicated volunteers team. I learn a lot from them. To be very honest, possibly I learned a lot from them. So these are some of the motivating factors for me.
Gautam sir, I have a question from Manish, and I think it's an important question. He's also saying that, I hope we are not getting fooled by people who are coming to us and asking for help. If they have assets which can get liquidated, and those are substantial in nature. His question is that how thorough is our due diligence when we decide that, okay, we need to move ahead and help a family or an individual?
Just to answer that Manish's question, when we select the first information volunteer, we put few criteria, like if it is from the current batch, so we try to select the volunteer who are from the recent batches, or who has some connections. It is not only that we just talk to the family and based on that we assess. We definitely have more information through the nearest BITNs or from the same city where the family belongs. So we try to gather from different places, but I don't deny the fact that it is. I will not say this information is 100% foolproof. There could be some lacunas in our information, but we try our best to gather information from different sources so that we can arrive at an optimum conclusion, that if the need is genuine or not. If there is any doubt, I remember in one case we have employed 4 volunteers to talk because we had some doubts, and based on that we come into the consensus. That is how we go about.
And I would like to just add to that, Gautam,
Yeah.
that
Yes.
that's one of the reasons why we also, for each category of funding, we also had a cap concept. Okay, so that if by mistake it turns out that some data was wrong or something, there's still a cap to what our exposure was.
Absolutely, sir. You are spot on, sir. Thank you.
Matthew, sir, you have a question. You may please go next. Now.
Okay. I just wanted to add on to Neha's question. I'm part of the finance fundraising committee along with Joe. And part of what motivates me is, like I'm along with, without having to, again, repeat what Niklesh and Ashok and others have said. Part of what motivates me is we've all left our colleges 30 years, 40 years, 20 years, 10 years ago. And we have, by all standards, done very well for ourselves. For me personally, it's just giving back to our institute and the community, the larger Bitosa community that we are all part of, that in ways, whatever ways we can. And COVID has made this whole thing, like Niklesh said, some of this very acute and something that's needed very urgently. And my hope is that as we work through this, and the team that has worked so hard and almost grew up organically, as we move forward, we can reach out to the communities beyond just our BIT family, but look at what we can do around the institute and things like that as part of a CSR and all that. Thanks.
You're on mute, Abhishek.
Gautam sir, I have a question actually to both Gautam sir and Ashok sir. How does one personally relate to what these families are going on? How do it may be a slightly odd question, but how do I motivate to contribute more? I mean, can we know some stories a little bit more firsthand?
Yeah. So Gautam, let me go first here.
Yeah, sir.
Because,
Sure. That's what I was about to say. Yeah.
No problem. So actually, I have been part of the fundraise drive, and that is one track on which you are reaching out to various subgroups asking for donations. So I realized in the process that the anecdote or stories that I'm hearing in everyday calls that I'm part of from the family group is something I would like to experience myself. And therefore, I requested Gautam, and he kindly included me in one of the calls where I had to speak to the wife of a BITN who succumbed to COVID, a young guy who was only 38. And it was with a lot of apprehension that I got into that conversation with the wife. Gautam and I were in that call. It was obviously very emotional for everybody, but what one has to do in these situations, it was a learning process. Nobody has a great amount of experience going through this, but it was so gratifying to hear the wife talk glowingly about her husband and what a great human being he was. And all one had to do was lend an empathetic ear to what she was saying. And as it concluded, she made a comment which really touched all our hearts, where she said she had been part of several Bitosa events along with her husband, and she would love to be part of the community going forward. And I think we offered that we will include her in forthcoming Bitosa events, and she and her young son. So there is a opportunity for us to continue to include people who from the BIT, college, who have left us, but their families can still be part of the Bitosa community. Obviously, every donor would not have the opportunity or would not have the time to be in similar conversations. The less such discussions, the better, I think. We don't want too many tragic incidents like that. But the Bitosa portal, the Bitosa Global Org, under the COVID link, provides a lot of information on what help is being extended. So if someone spends time there, you will actually see the efforts of outreach to impacted people, what help is being extended. It is only by word of mouth and by reading more about the impact that this whole program is having that I think people will get more and more motivated to contribute and continue to be part of this initiative.
Thank you, sir. That's helpful. Yes, Gautam, sir, while you answer this, maybe you could answer another couple of quick questions. Yeah. One is that can the donors be privy to the list of people who are getting help, or is there some privacy concerns around it? And then there is another question that how exactly are we currently helping families whose main breadwinner is lost and is in getting a job? So are we also helping beyond financial help and also helping people with jobs?
Okay, I will start with the last question first. It's not only the financial help, we are also trying to help the family members with possibly looking for some career opportunities. If the diseased person's wife is has some kind of qualification which can or other employable or has an opportunity to get employed somewhere, we seek the resume from the candidate and try to explore through among the BITNs to see if we can give any opportunity. If there is a student, we are trying to connect with them sponsorship program or internship program, or if the student has already passed out, we're trying to seek the resume. Our global team has the support team has been connecting with the student and who have just passed out or maybe passed out few years back, to provide them some kind of job opportunity. But as the process is getting evolved, we are in the beginning of this phase. It possibly will take some more time before we can concretely give them some kind of opportunity. But some internal internship program, we have already enrolled some student, or we are in the process of enrolling some current batch student. So that is apart from the finance support we can definitely give. Then the another question was any emotional stories, like Ashok sir has mentioned about one story. Yes, we both were really touched by the way that lady talked about her husband's thing. And there is one more case, possibly many of us know, where the case was very complicated. It is beyond COVID. His father was suffering from COVID, then got discharged from there, had further post-COVID complications, had to be admitted again in a good hospital like AIMS, got under treatment. We tried to provide them support from whatever way. And we have one of our volunteers, like Sunny was a single point of contact, who tried to contact with that boy, give them emotional support apart from other volunteer support. And we are happy to say that that boy's father has been discharged from the hospital after successful operation. There is one more case quickly where it was very emotional kind of thing, where the young faculty member has died, leaving two very young kids. The wife doesn't have any clue whatsoever what her husband has put in. So it's very challenging. She even doesn't know about any bank account or anything like that, and doesn't have any clue how she can manage the raising of her two children. So these are the kind of emotional uh, situations we have faced in through different families. So I think it's up to the donor. I mean, it's a human cause. I remember in one of the previous CoviClaves, one young girl VITN said that if this is the time, if now someone can't help now, then when can that come? Time will come. So going with little bit emotional, but seeing those cases, it's really time to reach out to the family and help whatever way. It's not only money. If someone can bring in some job opportunity for young VIT student, that will be very good. So there are many ways we can connect to our VITs.
I would just
Ashok
like
sir, I
to,
have, sorry, go ahead next.
just 1-2 sentences to what Gautam is saying. One is on the privacy question. Yes, I mean, there are some privacy concerns as to give specific names. And I don't think some of the families will like it. So, you know, while we do make some judgment calls, the family group and the finance group has all the details, because when disbursement is done, we even go down to bank account number, PAN card, Aadhaar card, those kind of things. Those documents are kept here. But how much to, accept in the form of stories is a difficult issue. The other thing which the expense committee also raises is what Gautam mentioned of internal internships. Okay, one is just giving cash. The other is, suppose the person is a student, most probably the person knows a BIT student, the person knows programming or something. He or she can help this committee itself in so many ways, websites, this and that. And then the committee pays. After all, we have the funds. The committee pays them like an intern, and that becomes an income to the family rather than just writing a check. Okay. Just last week we had another case. Ayush is on the call. Kaustav, others are on the call. Okay, where the prescription was given for the discharged parent, and one of our persons in the expense committee, Rahul, actually got the medicines shipped from Ahmedabad. Okay, at a much lower price for a saving of nearly 22,000 rupees. So, which can then be used for some other, situation. So there are very creative ways of using the funds that we have and getting it to the thing. But the good thing is the family group takes a holistic support. It's not just give cash to someone. It's all that career counseling, legal help, insurance help, so many things.
May I, Atul Chatta sir, may I ask you to go ahead and ask your question quickly?
Yeah,
we
sure.
are absolutely out of time now.
Yeah,
so
sure. No, I was very quickly, Nick, since you mentioned privacy concerns, could we kind of not divulge the names, but the story itself? One or two such stories, I think, will be very helpful to motivate the donors.
Correct. We can tell the story with, as long as, it cannot be traced back very easily, like if we say, Professor so-and-so in there, where it becomes too detailed, but a professor may be okay kind of thing,
Yeah, thank you.
I agree. Yeah.
So Ashok sir, to you, the last question, very last question. Chandrasekhar made a point around sponsorship group. So could you please talk a bit about that, and then we'll just wrap this up.
Yeah, so as part of the family support group, there are several initiatives, and one of them is the sponsorship group. And someone had asked a question earlier about how to keep this sustained. It is around a crisis that all of us have assembled, and we are trying to do the best we can as BIT alumni. But I wanted to point here that even within this, there were several people who reached out and said they want to contribute and participate on a long-term basis. And as is to be expected from such great gestures, they have requested that they remain anonymous. And, I'm very tempted to name them, but I have to defer to their requests. So these sponsors have volunteered to support BIT students who have lost a bread earning parent. And they have said that they would provide financial support for these students for the rest of their stint in the institute, as well as career counseling support, and help them at least till the point that they go to the next stages of their lives, either for higher education or for their first job. So it was very heartening to go through that process, and I'm very happy to state on behalf of Gautam, under whose purview this whole program is running, that out of the 4 students who qualified for such sponsorship, 3 have been assigned to sponsors amongst our alumni, and conversations are already underway between that student and the sponsor. So they are making extremely good progress. We are trying to develop on that track also as to how we can attract more sponsors. Perhaps sometimes there could be situations where a student needs to be supported by more than one sponsor, but there will be a primary sponsor who's the interface for that student. So I think a lot of excellent outcomes have been achieved through this crisis. The crisis itself is obviously not welcome, but we have got together in a way where I think beyond the event itself, we have some potentially sustainable programs in place, and we should commit to ourselves in the group that we will continue building upon that.
Thank you so much. We'll just end this now. I would really like to thank the speakers, the audience for making time on a weekend, and the unsung volunteers for making this work like a magic. You would have, some of you would have discovered how you are magically muted and unmuted at the right moment, and your video is switched on and switched off. So Pitosa Global, at its peak during our war room effort, saw participation of close to 500 volunteers who gave time right from as less as 30 minutes to as much as 20 hours in a day. And in Pitosa Global, we believe that no effort is insignificant and no contribution is small. So please make time, and please be generous in making your contributions.
Abhishek,
also,
can I, after you conclude, I want to make a final appeal on that point. Go ahead.
So please go ahead. I'm done.
Okay, thank you, Abhishek. So this is a fervent appeal to all of you, and to your friends to reach deep into your pockets of compassion and convert those into rupees or dollars. We realize that there are probably many fundraise programs that you're contributing to, but this one is special for you because it is for your institute's community, your batchmates, seniors, juniors, current students, professors who have made us what we are today, and their families. So they are in pain, so please help. Remember that all of us have unarguably spent the best part of our 4 or 5 years of our lives in an institute, so we owe it to them. So please step up and let's make this happen. Thank you.
Thank you. Do follow us on Facebook, LinkedIn, Twitter, Instagram. This very talk will be available on YouTube. Make time to register on bitosaglobal.org. And thank you, everyone. Thank you once again. Have a great day ahead. A good night. See you all soon. Bye-bye.
Thank you.
Thank you.